Hello everyone. We are back with our interview series. So today we will introduce you with our psychologist, Shravya Devdhar. She has done her MPhil in clinical psychology, and she is really wonderful therapist as well as a good friend of mine. So then we will start asking her questions. So hi Shravya, how are you?
Hi Swapnil, I'm doing good. How are you?
Yeah, I'm good too. So, tell us something about your qualification, where you did it, and how was it?
I did my bachelor's and master's from Bangalore. I'm from Bangalore, so I did bachelor's and master's from Bangalore. And after doing master's, I worked for a while at NIMHANS, and then I worked with Dr. Malvika Kapoor, who is a well-known child psychologist who adapted CBCL to India, Child Behavior Checklist to India. I worked with her in a project, and I worked at NIMHANS with the people who were responsible for the working group which was responsible for recommendations to WHO about internet gaming disorder. With them, I worked in a project for internet addiction and the correlates of internet addiction. Then I got into the MPhil program at Amity in Mumbai. So I was interning at Regional Mental Hospital with you and our classmates and at SRCC. And I worked with a lot of people with substance use, mood disorder, psychosis, children with ADHD, learning disability. So it helped me learn a lot about all these people.
Okay, wonderful. So you have experience of working on the structural part where people recommend or construct test and all. You have worked with Malvika Kapoor. You have worked with Niman. That's really wonderful. But where it started, like when you decided that you want to be a psychologist, how it started?
Okay, I think two things contributed to it mostly, largely. So, one of the contributions was I have always been a very curious person ever since I was a kid. I was that kid who would ask a lot of questions, maybe some which were really annoying to the adults, and was always asking questions. So, that was one thing. I was very curious about human behavior, about the differences in people or differences in the same person, like how we have the capacity to be incredibly kind and supportive at the same time the same person can be incredibly cruel. So what are the how are their contradictions? Those kind of things were very interesting, that made me very curious, that got me into it. And the other thing was I'm an introvert, and growing up I was given a lot of criticism for it in school. I was criticized for it, and as a kid, that is something that's really important. Peer approval is something that's really important. So that was a difficult experience for me. So I know firsthand how difficult it can be. So I wanted to be there for people. I wanted to prevent such a thing from happening, or at least be there for them and be supportive when they're going through such a thing. So that was the other piece. So these were the contributions.
Yeah, wonderful. And if I can remember, I can recall, I have seen all those things, the curiosity and the firmness or assertiveness in knowing things in the accurate way. So I remember whenever we used to talk about things, you used to be very accurate on that. No, tell me, give me the reason, give me any study, supportive study. So you used to be curious. So yeah, this is how it started, and I have seen it during the MPhil period also. Wonderful.
Yeah.
And finally, now you are a psychologist. You have good experience. You have good qualification. How does that make you feel, and what kind of experiences you get as a psychologist?
Okay, so currently I work with pediatric cancer survivors. So this is a sort of like a new field for me. I get to interact with a lot of kids, and it's so incredible to see how resilient they are in spite of having gone through such a difficult thing of having cancer when you're just starting out in life. It's an incredibly difficult experience, but the most majority of them are resilient, and they have the resources within themselves to support themselves, and it is really nice to be able to be in their company and watch them go through this journey and become the strong people that they become. And it's understandable if they end up having some difficulties, and it's very fulfilling to be there to help them out through difficulties. And these kids may end up having some cognitive difficulties, like difficulties in attention or learning or intellect and things like that. So basically, we are helping them with that. So I'm working with an NGO, and the NGO is supporting them to provide them intervention in case there are some cognitive or psychological difficulties. So it's very nice to be there with them through the journey.
Okay, good. And it's good to know that you are working with pediatric population and specifically who are going through a cancer experience. Yeah, and as a psychologist, how does that make you feel? Like being a psychologist, working with kids, working with other people, how does that make you feel?
So being a psychologist has been something very fulfilling for me. And so, like I said, it's amazing to be a co-passenger in the journey of people. It's great to I find it like an honor to be able to be with people and listen to their stories. That's something that is really important to me. And it's also challenging at times. There are a few challenges the because our society at large might not be supportive, really supportive of the work that we do, or of our of the people that we work with. They might not be supportive of those people, and it's challenging to have to see them go through things like that. But at the same time, it encourages us to do better, and it encourages us to look at what can be changed and study more and apply it to our culture and help people in different ways. So I think it is challenging and fulfilling as anything valuable should.
Yes, I have also experienced same thing, that as it's challenging, that makes me more interest, pulls my more interest in that, because like people do lack awareness. There is no understanding about mental health. People don't know about disorders, general health and mental health. When to call normal, abnormal, stable, unstable. So that's why I like to work with that. So I think our experience match. Yeah,
Yeah.
and. So, Shravya, what are your interest areas as a clinical psychologist, and what are your specialization?
Okay, so I work usually using the acceptance and commitment therapy model. So I think it's very applicable to our culture because it has a lot to do with mindfulness, meditation, imagery, stories, and I think stories and um, expression of art is a very important part of our culture, which coincides with acceptance and commitment therapy, which has a lot to do with experience and meditation and art. So I think that trait is very applicable, and that is I have also corresponded with one of the founders of acceptance and commitment therapy. I've emailed him a couple of times. So, and I'm in the community which works for this. There's a professional community called Association for Contextual Behavioral Science, which I'm a part of, where I discuss about what are the challenges that come with our culture, and then I get inputs from other people working in my culture or in somewhere else like Africa or somewhere else like Australia or something like that. So that is one thing that I specialize in, and I'm currently really interested in something called as the polyvagal theory, which was put forth by Stephen Porges. It's basically about how when we've had stressful experiences, like maybe it could be something that is um, too long for too long. Anything stressful is something that is there. It need not be something that is defined as trauma, but something that is adverse for too long, or something that is very shocking and there for a short period of time, or something that challenges our resources and our internal resources are not able to cope with it. These kind of things are, he defines them as stressful, and then those can have an impact on our nervous system, and we can respond to it in different ways where we're not even aware of it, and then it has an impact of how we behave, and which again causes stress. So that has been something that is that has been interesting for me to study as of now. And I'm also reading this book called The Body Keeps the Score by Dr. Bessel van der Kolk. So that has, these two things have been something which are closely related to each other. So they have been interesting. I want to explore more about that and bring it into my practice.
That's really nice. So acceptance and commitment therapy and this new part you are exploring, that's really nice. Now considering like this fact that in India, like there are very few registered clinical psychologists and you are one of them. So considering your qualification, your specialization, areas of interest, what kind of clients or what kind of problems people can bring to you as a therapist for consultation?
So I work with a wide range of difficulties that people go through. I worked with body image difficulties. I work with OCD, anxiety, panic disorder, um, depression. It could be bipolar, psychosis, substance use. These are the different kinds of people I work with. And what I think I bring to the table, and a piece that I bring to the table is something I think which is sort of lacking in our culture, which is the ability to be there for yourself. We are very compassionate people when it comes to other people. We're very giving, and it's in our culture to be there for other people, but then we forget about ourselves. So I think that's the piece that's important. Self-compassion is a important part of my practice, which I think is very relevant for us Indians.
Yes, and that's really, really important. Nowadays, I'm also trying to work on it highly. So I'm taking breaks and taking care of self because I do teach and explain it to everyone. I used to slightly follow it. Nowadays, I'm trying to completely follow it. I'm also running behind one of a well-experienced therapist for my own therapy session, just regular therapy sessions. So yes, it's highly required, and yeah, definitely, it will be really amazing if people will start coming out for help regarding body image, OCD, anxiety issues, depression, substance abuse, yeah, mood issues. And I will request people, so if you are going through such issues or if you are doubting it, so you can contact Shravya for that. And now coming back to end part, like as we had talked earlier, that there is lack of awareness, understanding, and acceptance, focus towards self, and all those things. What you would like to, what message you would like to give to our listeners who are watching us or listening us?
Okay. I think it is very I think it is very different for different people. There might not be a one size fits all, but I will try to do the best I can. So I think what is important is there's a lot of messaging that we get that when we have mental health difficulties, it's your own fault. You should be able to pick yourself off of it, dust yourself off of it, those kind of things. But it's important to know that there are things which are far beyond our control. So even gene expression gets changed because of the environment or experiences that we are given. So something that is far beyond our control. So if that is the case, we owe it to ourselves to not to blame ourselves. We owe it to ourselves to be more compassionate to ourselves, and at the same time take responsibility for our healing rather than the culture gives the message that we should, it's our fault or we are doing something wrong. That is not the case. There are a lot of things which are outside our control. So we need to recognize that we are born the way we are, but we just need to recognize that the healing is our responsibility, not the things that have happened to us, but what we're going to do with the things that we have.
Yes, it's really important to focus on healing because I also see many clients or many people who try to find out the reason and they try to justify or clarify what happened and exactly how it happened. So most focus should be on healing and recovering. Yeah, that part is also important, but healing is we should be always major priority. Yes.
Yeah.
So I will put your contact details in the description. Also, the name of the book you mentioned. That's really wonderful book. And I think we will end interview here. And thank you so much for spending time. Thank you so much for being there and sharing your experiences and views with us.
Thank you so much for giving me this opportunity, Swapnil. And I must say, I have learned a lot from you about therapy. Being the experienced classmate that you were, there were a lot of things that I learned about how to be with people, how to connect with people from you. So thank you for that. And thank you for this opportunity.
Yeah, always welcome. And listeners, if you have any doubts or anything to want to ask or share, you can drop it in comment and we will reply to that. Yeah. So thank you. Thank you,
Thank
everyone.
you. Thank you.
Yeah. So you can